Welcome. Today we will go through this lecture, Introduction to Public Health. My name is Dr. Zeeshan and Community Health Medicine. We'll go through the first slide. We'll go through the introduction to public health. These are the learning objectives. Define common terminologies used in community development, comprehensive healthcare, historical development of Pakistan, development of public health in Pakistan, social action program, and major health problems in Pakistan. We'll go to the first slide, and we should all know about the definition of health. That's quite repeatedly asked. It's a state of complete physical, mental, and social well-being, and is not merely the absence of disease or infirmity. According to WHO, World Health Organization, 1948. The other one is the extent to which an individual or group is able to realize aspirations, satisfy needs, and to change or cope with the environment. The definition of public health, we will go for it. Public health is a science and the art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. According to Charles Edward Emory Winslow, 1877 to 1957, was founder of the Yale Department of Medicine. Community medicine. The term preventive medicine and community medicines are used interchangeably, regarded as a specialized field of medical practice focusing on health of a defined population in order to promote and maintain health and well-being, prevent disease, disability, and premature death, as per our book. Yes. Applications of primary, secondary, and tertiary preventive measures. As you can see on the slide, we have seen two slides. One on one side, you can see the job descriptions, and on the right-hand side, we have community medicine subspecialties. We usually have subspecialties as we have must go through it and will come across it. Epidemiology, biostatistics and informatics, environmental health science, social behavioral sciences, disaster management, and emergency preparedness, health service administration, global health, community health, maternal and child health. As we can see in the job description, planning, organizing, management, financing, evaluation of health programs, the control of communicable infections, the education of people and masses about personal hygiene, the organization of medical and nursing services for diagnosis and prevention, and development of health policy vaccines to prevent disease from spreading. This is a slide in which we can see the public health approach. It's a model that we can see that what is the difference in between a public health specialist and a public health. It's a model versus public medical specialty in a model. In the slide, we can see that an individual is there, which is representing a medical fraternity or a facility in which only one person sees one patient. As on the other side, in the public health sector, we see as a community as a whole. So we have to treat the disease or a condition or any kind of factors that has been coming to community as a whole population, whether it's district, globally, or by certain public sector. Public health and healthcare. This is another slide. We can see what this differentiation between a healthcare individual, as we can see as a clinicians, in a public health sector. So we can see what is the main difference. In the healthcare, physician usually sees individual patient focus as well. It's compared, it sees as a population focus, personal service ethics, and it goes to public health ethics, prevention of public health emphasis, and diagnosis and treatment emphasis. Joint laboratory and field involvements, joint laboratory and just the individual patient involvement, as you can see. The clinician science preferable to professional training, clinical sciences essential to professional training of an individual. Public sector basis and private sector basis. Next slide, you can see selected public health terminologies as we need to go through this, and every individual have to know the definitions, and these are can be repeatedly asked in the exams. Endemic disease native to an area or population, as in Pakistan, we have different endemic diseases, malaria, TB, etc. Then we have epidemic disease affecting numerous people at the same time. Then epidemiology, study of incidents, distributions, and control of diseases in a population. We have the huge epidemics. We have COVID as a pandemic, and we have measles outbreak as an epidemic. And the study of it is called epidemiology. Incidence, the number of new events, cases in a population requires a specified time period and a defined population. Intervention, in public health refers to the action program that is meant to benefit the health of the population. Examples might include legislation, education, or service delivery. Morbidity, portion of disease, illness in a population, relative incidence of a disease. Mortality, number, frequency, or proportions of deaths in a population. Outbreak, sudden rapid development of a disease in a population. Pandemic, an extensive epidemic affecting a very large region, such as the country, continent, or the world. COVID is one of the examples you guys went through. Prevalence, proportions of a population with a specified condition and illness requires a specified time period or point in time. That's really important. Relative risk, several meanings, including risk of an outcome in those exposed to disease versus those not exposed. The calculated odds ratio resulting from a study. Risk odds of an event occurring as in the 1 in 100 chance or risk of dying. Mortality rates, there are two important definitions that you guys have to learn by heart as well and has completed and repeatedly asked in exams as well. Infant mortality rate is the death of a child less than 1 year of age. Neonatal mortality rate, number of deaths within the first 28 days of life per 1,000 live births in a given period. Maternal mortality rate, the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the site or duration of pregnancy from any cause related to cause or aggravated by pregnancy and its management, but not incidental or accidental causes. Comprehensive healthcare. The practice of continuing comprehensive care is the concurring prevention and management of multiple physical and emotional health problems of a patient over a period of time in relationship to family, life events, and environment. In this in the slide, we will be briefly describing the historical developments of public health. It's mostly a timeline, as we can see, started from ancient Greece and the Roman Empire, from 23 to 476 AD, to the Middle Ages of 476 1415 AD, to 1600 to 1880 of birth of modern medicine. Then the Great Sanitary Awakening, which happened in 1800s to 1900s, and modern public health in 1980 onwards. It started with the ancient Greeks. They started in the public health. They have the first knowledge of personal hygiene. They started caring about the personal hygiene, personal physical fitness. They started the Olympics with the competitive games towards each other and naturalist concept. Disease caused by imbalance between man and his environment. Public baths of cleanliness, hygiene, maintenance. Then there were Roman Empire from 23 to 476. They adopted the Greek public health values by hiring Greek physicians. They hire engineers to design sewerage system, aqueduct, bring fresh water in the city, and have public baths and private swimming pools for personal hygiene, private water supply. Physicians are employed by municipalities to provide health services. This is one of the pictures of how the Roman aqueducts were and how the water was used to be transported from outside the city to inside the cities where they have huge rooms for public bathing. This is one of the pictures. As you can see, they have heated pools and how they have public baths. It used to come from the aqueducts and bring the water in the city. And through that, they used to heat it, and then that's how they have a concept of cleanliness and personal hygiene. Rise of public health, the 19th century, the Great Sanitary Awakening. In the era of unplanned industrialization in 19th century, the Great Sanitary Awakening symbolizes the identification of filth as both a cause of disease and a vehicle of transmission, and the embrace of cleanliness as a remedy. As you can see in this picture here, we have, you can see a densely populated city where lots of people outside standing and gossiping with their children, and there is a lady out there who is showing everything outside in the streets, all the filth and their kitchen dirt and etc. So development of public health activities in health, Edwin Chadwick, a London lawyer in 1838, is one of the most recognized names in the sanitary reform movements. Under Chadwick authorities, a commission conducted studies of the life and health of the London working class in 1838 and that of the entire country in 1842. To remedy the situation, Chadwick proposed what came to be known as the sanitary idea. His remedy was based on the assumptions that diseases are caused by foul air from the decomposition of waste. To remove disease, therefore, it was necessary to build a drainage network to remove sewage and waste. Chadwick's report eventually was adopted in the Public Health Act of 1848 in UK and subsequently American Public Health Act 1872. As you can see, in the 20th century, US mortality rate from 1900 to 2001. As you can see in the slide, deaths per 1,000, which were soaring in 1900s to around 17 deaths per 1,000, and it drastically dropped from 1900 to 1925 to 1934. It dropped to around 11 and 10.5, and it continued to decline and goes ahead to 2000. which is around 8. So that's a drastic improvements in the Sanitary Act and the Great Sanitary Awakening by passing the Public Health Act and law. That's how it changes the whole situation. Cholera public health approach. It also gives an idea that how a public health act can be adopted by law and implemented and how it can reduce the diseases in the society. Cholera, a fatal intestinal disease, was rampant during the early 1800s in London, causing death to tens of thousands of people in the area. Cholera was commonly thought to be caused by bad air from rotting organic matter. John Snow, physician. This is one of the John Snow who is uh, repeated in the public health sectors around the world. Repeatedly asked about it. John Snow is the best known for his work tracing the source of the cholera outbreak and is considered the father of modern epidemiology. This is one of the most important pictures in the history of public health, and that's how John Snow was has created a science called epidemiology later. That's the study of epidemic. As we can see in this map, on your left-hand side is the street map. That's how John Snow got it. Every death that happened due to cholera, he used to make the dots all around it. And you can see deaths from cholera on the top-hand corner. On the right-hand side is a Broad Street pump, which he correctly recognized as the main cause of the cholera, which he later discontinued it, and then there will be a drastic drop in the death ratio because of the contamination it caused because of the water source. Intervention evaluations, what works? Through continuous research, Snow understood what interventions were required to stop exposure to the supply of contaminated water in the area. As we can see, when we are studying the story behind it, the cholera deaths were really high. Cholera deaths per day was drastically high, as you can see in this. Through the September, in the August and September, it rose to around 140. It peaked. But when he, he devised a plan how to stop the deaths, it, he removed the handle to move from the Broad Street pump, which was basically supplying the water to the entire neighborhood and the areas. And because of the consumptions of that infected water, it caused cholera and lots of deaths were happening. After that's brought from the handle was removed, the death ratio drastically declined and come to around zero, almost zero, which was negligible. At least it wasn't the source of that water. Implementation. How do you do it? John Snow's research convinced the British government that the source of cholera was water, contaminated with sewage. Thus, Broad Street Pump to supply water was sealed forever. And it's still there in London. If you go and see, it's a epitome of how the public health works. Development of public health in Pakistan. We have lots of development in public health sector in Pakistan, and it starts from the EPI vaccination program, safer workplaces by implementing laws, safer and healthier foods by fortifications. In the healthy foods, we can see the iodine fortifications to irons to calcium in our daily day-to-day foods, in the breads, etc. Motor vehicle safety, control of infectious disease, family planning, declining in morbidity and mortality, recognition of tobacco as health hazard. Social action program. Social Action Program was initiated by the government of Pakistan in 1992 as a multi-sectoral policy initiative intended to increase the quality and quality of investments in basic social services, that is, primary health care, primary education, population welfare, rural water supply, and sanitation. Here is another. A social action project is a multi-step process in which youth addresses an issue they care about, learn about it and potential solutions to solve it, then take actions to create positive change and on this issue. Good social action projects involve community members and stakeholders in their implementation. As we can see in the diagram, you can see we have multi-sectoral approach and we have multiple sectors involved in it. We have education, we have to educate, serve, educate, advocate, unite, speak out, and engage. Major health problems in Pakistan, as we've seen this, the major public health issue. Pakistan is at higher risk of epidemics brought on by communicable disease due to overpopulation, unsafe drinking water, bad sanitation, deplorable socioeconomic conditions, low health awareness, less educated people, less awareness, and insufficient vaccination coverage. Major diseases in Pakistan, 20 infectious diseases include TB, tuberculosis, measles, rubella, influenza, RSV, pertussis, diphtheria, leishmania, EBV, Epstein-Barr virus, pneumonia, Haemophilus influenza, VZV, varicella zoster virus, mumps, dengue, malaria, polio, typhoid, hepatitis, HIV, and diarrhea are notifiable in Pakistan. You can see this is a pie chart. As you can see, it shows acute respiratory infections, ARI, which is around 51% of the total population. And as well as you can see, the malaria holds 16% of it, diarrhea 15%, dysentery 8%, scurvy 7%, and 3% are red. These do fluctuate through time and time again. And this is most of the acute viral respiratory infection, which occupies most of the disease. Thank you. That's all for the lecture.